So it's time for your client with an SCI to discharge from the hospital. What's next? In this video, I'll walk you through tips and best practices to help your client stick with their bladder and bowel management routines long after discharge. Welcome back to the final video in this series as we explored OT's role in bladder and bowel management programs in individuals with spinal cord injuries. I'm Julia, and today we're talking about what happens after rehab, how we as OTs can support clients as they transition back to daily life and reintegrate into their homes and communities. Let's be real. Incontinence does not need to get in the way of running errands, attending social events, or participating in physical activities. We'll cover practical strategies like preparing a CIC go bag, navigating public restrooms, and additional consideration for clients returning to recreation or fitness. Most importantly, we'll talk about the need to continuously monitor bowel and bladder routines over time. These programs aren't a one-size-fits-all. They can and should evolve to fit the client's needs, daily routines, and any progress that they've made. Let's go. First up, let's talk about getting out the door. Whether your client is attending a medical appointment, meeting up with friends, or just running errands, preparation is everything when it comes to bladder and bowel management routines. One of the easiest ways to reduce stress is to help your client build a CIC go bag, a discreet, ready-to-grab bag stocked with the essentials that they'll need when they're out in the community. Here's a quick list of what to include. 5 to 6 pre-lubricated catheters, or catheters of their choice. It's smart to pack a few extras in case one gets dropped, or for female clients if the catheter is inserted into the wrong opening. Of course, gloves and lubricant if it's not already included with the catheter, antiseptic or BZK wipes and hand sanitizer, pericare and disposable bags, a small towel or underpad for surface protection, a change of underwear or clothing in case of any messes, adaptive tools like catheter inserters or mirrors if used, and not necessarily in the bag, but setting up a phone alarm in case it might slip your mind while running errands. Another optional item is a travel-size cleansing spray or deodorizer for dignity and comfort. It's helpful if the bag is discreet and organized, so clients feel confident carrying it anywhere. Some discreet bag examples include a camel bag or a 3-day assault bag as it's narrow enough to fit on the back of a wheelchair. Encourage them to keep one packed and ready at all times. Next, public restrooms can present a real challenge, especially when it comes to privacy, hygiene, space, and time. Some clients may feel anxious about needing help in public settings, especially when facilities are not wheelchair accessible or lack supplies. Here are a few strategies to help prep clients for public restroom use. First, practice catheterization in a variety of positions. Examples include on the wheelchair or transferring to a toilet to build flexibility. Scout restroom options in advance, using apps like Wheelmate or Google Maps accessibility reviews. Encourage clients to map out backup locations, especially on longer trips. Teach fast setup and breakdown techniques using AE so that they feel efficient and in control when they're out and about. Review hygiene strategies when sink access is limited, like using hand sanitizer or wipes. And really, it's all about reducing the unknowns. The more clients visualize and rehearse toileting in the community, the less overwhelming it feels when they actually do it. Let's shift to another big area: physical activity and sports. Many clients want to return to recreation, whether that's adaptive sports, working out at the gym, or just getting back to outdoor activities. As OTs, we plan to support that transition by helping clients plan ahead for bladder and bowel needs during physical exertion. Here are some key tips to review with clients. Plan for catheterization before and after physical activity. Movement and exertion can increase the urgency to void, so it's helpful to empty the bladder before starting and after as needed. Expect that the activity may change their routine. Some clients may find that sitting balance, trunk control, or clothing changes are more difficult post-workout, so practicing those routines when fatigued can be a useful part of therapy. Hydration is critical. Encourage clients to stay hydrated, but also understand how hydration can affect their CIC schedule. Scout the space ahead of time, whether it's a gym, track, or a park. Help clients look up the nearest accessible restrooms or locker rooms where they can carry out their bladder or bowel routines, and include AE in their gym bag. This could be a second go kit with the same CIC supplies, hygiene tools, and maybe even an extra towel or change of clothes just in case. With the right prep, clients can feel confident engaging in physical activity without fear of accidents or interruptions. And that's a huge part of restoring quality of life after injury. One of the most important reminders that we can give our clients and ourselves is that bladder and bowel management programs are not static. Just because a strategy worked in inpatient rehab doesn't mean it'll still be the best option 6 months or a year later. Here's what we want to emphasize. Functional status changes. As clients build strength, endurance, and confidence, they may be able to manage more of the routine independently and/or may require less caregiver support. Life circumstances evolve. New jobs, living arrangements, or goals can impact bladder and bowel routine, and we want their program to work with their life, not against it. New products and tools come out all the time, from catheter systems to positioning supports to adaptive clothing. Staying informed can help clients transition to options that are more efficient, discreet, or dignified. Lastly, regular check-ins matter. Encourage clients to advocate for themselves by bringing up toileting challenges at follow-up visits, and always include reevaluation of bowel and bladder routines in OT check-ins. Reassessment is not about fixing something that's broken. It's about making sure that the client's program is working for who they are now and not who they were at discharge. And that is a wrap on this video and the entire series. We've covered everything from bladder and bowel physiology to functional assessments, intervention strategies, and now how to support clients as they return to life outside of the hospital. If there's one thing that I hope you take away, it's this. Bladder and bowel management isn't just about hygiene. It's about autonomy, confidence, and full participation in meaningful occupations. Whether you're supporting someone through inpatient rehab, community reintegration, or long-term adaptation, I hope this series has given you the tools, the language, and perspective to show up with clarity and direction. Thank you so much for learning with me. If you've made it this far, you are amazing. Keep advocating, keep asking good questions, and keep empowering your clients. If this video helped you, don't forget to like, comment, or share this video with a colleague, and let's keep the conversation going. Thank you for watching.